Hello, my name is Marcy. I'm an occupational therapy graduate student at the University of New Mexico. I am doing this video and others like it in an effort to educate farmers and agriculture workers. This project started as a research project that I did with my professor, Patricia Siegel, and we looked at some of the most common musculoskeletal injuries in farmers. And I wanted to take that information and make it digestible for the common person so I could talk to you, the farmer, about what injuries you might sustain and what to do if you get those injuries. Today, I want to talk about something that's close to my heart and I think not a lot of people know about, which is hand therapy. So, if you're not familiar with occupational therapy or physical therapy, you might not know that there's actually a subspecialty of occupational therapy and physical therapy, which is hand therapy. And in order to be a hand therapist, it's quite a process. First, you have to be a physical therapist or an occupational therapist. Then you have to go on to work something about, I think it's about 4,000 hours of direct patient care. So that means that you are caring for patients with hand injuries for 4,000 hours worth of time. That's a long time. And then you're able to sit for a very, 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 very challenging exam. And if you pass, you are a certified hand therapist. So it's quite a process. But what does this mean for you? First of all, knowing that there's a specialty in hands is really important, because then if you do have a hand injury, an elbow injury, you know to advocate for yourself. Hey, I know there are special occupational therapists that treat this injury. Can I see them? And that's something that you can say to your doctor. Hey, can I get a referral to occupational therapy? Super important. It's also important because these are highly trained individuals that are really able to give you such nuanced information and such great care. There are some therapists that have just been practicing for so long. They have such a wealth of information. And when you specialize in a certain area, you accrue so much incredible knowledge and specific knowledge that sometimes even a doctor might not have that kind of information. I'm not saying that we're better than a doctor. I'm just saying that when you focus on one thing for so long, you get to know a lot about it. And so some hand therapists have a really in-depth wealth of knowledge, and they might even have facts or tidbits or information that you can't get anywhere else. And if you don't know, you don't know. Because before I started my journey to occupational therapy, I had no idea there was a subspecialty called hand therapy. Never even thought about it. But there is, and it's super important to know, because one day if you find yourself in that situation with a hand injury, you know what to do. I hope this helps. If you liked it, comment, share, like, tell me what you want to know about, and I will make a video. Thanks so much. Bye.